Good morning, everyone. I'm very happy that we are here together. Today, Merck Foundation is providing this health media training for the Gambian media representative for the first time. And this is in partnership with Her Excellency, the Gambia First Lady, Her Excellency Mrs. Fatoumata Bah-Barrow. And she is also the ambassador of Merck Foundation More Than a Mother campaign. I'm so happy that all our programs in the Gambia is very flourishing, very impactful, very real. And this is thanks to Her Excellency, the First Lady of the Gambia, and her team and her foundation for supporting and following up and keep tracking with all the impact, resolving problems and challenges and finding solutions, and the implementation of very, very difficult programs like ours, which is mainly focusing on sustainable development of health, capacity building, empowering women, supporting girls' education, breaking the stigma of infertility. It is very difficult, very diverse, but we are very happy with the results and with the collaboration and the partnership, which started in 2015 with 2017 with Her Excellency, the First Lady of the Gambia. We have 5 stories. A David story, it's about how to emphasize the family values of love and respect, whether they have children or not, and whether the infertility is a shared responsibility between husband and wife. This is a really amazing one, and we had tailored to the Gambia with a name, I think it was Moses story. And also we have Educating Linda, and this is about girls' education and how child marriage should be prevented. Because yes, here is David's story, and it was it's here localized to be the name of the story is in Gambia. It should be written here. But I think it's, you will see it later, but please I ask my team that to share the presentation properly with the name of the Gambia story. It should be done without me saying that. Okay, and next is Educating Linda story. And Educating Linda story also, it's about girls' education, and also it's been tailored to the Gambia with the different names. I will get the names now at the end of my presentation to you, so you understand, and it will be shared with you all, the right version with the message of Her Excellency, the First Lady, attached to it. So this has been distributed on 30,000 school girls. And actually school students in general, 30,000 copies from these 2 stories, and it was really amazing because they read and they get sensitized about this. And the right choice, make the right choice. It's also about make the right choice. It's about raising awareness about coronavirus, because also we contributed to coronavirus. Yes, make the right choice. It's a very nice story that raising also awareness about coronavirus, have to wear your mask, wash your hands, and keep social distancing, and keep working, and keep loyalty and honesty even under the pressure of a global pandemic. And this is very, very important as well. The 4th story is Rescue Jacqueline, and Rescue Jacqueline, or Jacqueline Rescue. It's about how we saved Jacqueline from child marriage, and this very nice story emphasizing in how she has the opportunity to get educated, to become a very important person in society, doctor or engineer or a school teacher, or something that is really, really adding value to her family, and to her future family. Next, please. the ride into the future. It's also about girls' education and how that bike that she is riding, and she got it from a friend of her family, helped her to continue her education until she became a very important doctor in the university. And this is also a hope, give hope to all girls, and give also solution that what they can do to continue education, and also give a message to women and mothers and fathers that don't stop your girl's education, because she has a potential she need to reach and to fulfill her dream. It's very important. Next. Not who you are. It's another story that also will be tailored for Gambia with the names of Gambian names, local names. And this is about gender-based violence, and how emphasizing that men should, or husbands should, respect their wives. And this is also, of course, for children, and can be all for all the community, because it's a very great message about love and respect within a family, between a man and a woman, a man and his partner. That's it. These stories I love very much, and it will also be sent to be distributed to into schools. We also have school items that it's 3,000 school items, with all the school items that will distribute on school students, to also emphasize on the role of education and support of Merck Foundation to education for all the school students in Africa, because this is the way towards a better economy and sustainable development goal.
We have so many speakers today, and I want to invite the first of our presenters today, Dr. Moses Chirwa, who is from Zambia. He's a gynecologist, fertility specialist at Chipata Health Central Hospital, and also an alumni of Merck Foundation. Dr. Moses, welcome.
All right, thanks a lot, Brian. And welcome to my presentation, where I'm going to talk about prevention and the link between infertility and infectious diseases, then together with male infertility. Next slide. Okay, yeah, so we have to break the stigma around infertility in Africa, and we are glad with Make More Than a Mother program, which has been doing quite a lot in this field. So basically, the entire discussion will focus on infertility prevention, then the link between infertility and infectious diseases, then male infertility. So what we need to know that it takes two to have a child, and therefore even men are involved in infertility. Okay. So if we look at infertility, it has been one of the most stigmatized diseases in especially Africa, with not so much that has been paid to by respective government. What we do notice is that traditional and quite a number of religious belief, cultural, combined with low resource environment, have been linked with quite a lot of higher levels of preventable causes of infertility in women and also in men. So some of these causes are the usual poor nutrition. Then we do have quite a number of sexually transmitted infections that haven't been treated, such as gonorrhea, unsafe abortions, unwanted pregnancies, young couples taking all sorts of going for all sorts of unsafe methods, ending up with pelvic infections and subsequent infertility. Then we also do have some cultural practices within Africa where they do female genital mutilation, and some of the consequences of female genital mutilation, other than the trauma which is caused to the pelvis, is that some women have ended up becoming infertile. And of late, we do have quite a number of our young women and men who are smoking quite a lot, and exposure to these pollutants from smoke, petrol, and other environmental pollutants, they can lead to infertility because they cause a toxic environment in the eggs and basically the seeds for the man and the woman, rendering that couple infertile. So we should raise our awareness about male infertility. It takes two to make a child. You can have everything correct on the woman, but if the man is neglected, if everything is not okay on the man, we are not going to get that fertility that we desire. So what we need to know is that men are very important when it comes to reproduction, and sometimes there is a neglected fact. Most of the time we tend to think infertility is just about your women, but we do know that men do contribute a significant contribution to fertility problems. If the infertility in men is neglected, it means we are only treating half of the problem, and as a result, we will not get our desired results. So those are some of the key take-home messages. Let's see some of them. Infertility is not a stigma. Infertility affects both men and women equally. Please, let's be informed. We visit our local doctors and discuss with them. And please, let's support our wives. Infertility is a shared responsibility between both the man and the woman. It takes both a man and a woman to get to have a child. Men are more than fathers and women are more than mothers. Break the stigma around infertility in Africa. Say no to infertility, men too, women and everyone. Let's break the stigma surround infertility, and please, can we create a cultural shift? And also let's offer support to our colleagues who are suffering from infertility. Together, we can create a cultural shift.
Thank you very much. I welcome everybody. Special thanks to Dr.Rasha Kelej and the Merck Foundation in general. My presentation today is going to be on management of couple or infertility and no to stigma. Our plan of presentation, we're going to look at the couple's fertility, where the physiology, look at body anatomy and physiology. We want to look at the main causes of infertility, both male and female causes, the basic treatments, and why we should not stigmatize people with infertility. Now, when you look at the anatomy and physiology of infertility, we're talking about both the female and male. When we talk about the female anatomy, we talk about the reproductive system, which includes the vagina, the cervix, the uterus, the fallopian tubes, ovaries, and of course, they are regulated by the hormones. Now, when you look at the male, you talk about the testes, the penis, which is also regulated by the hormones because the sperm are produced in the testes. Now, how do we conceive babies? So that means for a male and female to have babies, each must bring something in. And that is, a female brings what they call the ovum, a female, the man brings what they call the sperm. Now, these two things will meet together in the fallopian tube and cause fertilization. And after that, they will come and implant in the uterus or the womb, and then pregnancy is achieved. However, infertility can be caused by the obstruction in any of these physiologies. So you can see that the vagina, the sperm is here from the man, they travel through the cervix, they get into the uterus, get into the womb, and then fertilization will happen here because the egg will come out and they will meet on fertilization. So for a female, every month, one egg will come out and meet with this sperm here and fertilize it. So if that happens, fertilization happens and they come and implant here in the uterus and pregnancy is achieved. So that means any problem with any of these things can cause infertility. Either the sperm that is coming is not good, or there is no sperm coming, or there is a problem at the cervix they cannot pass, or they go into the uterus, they cannot meet the ovum in the fallopian tube to fertilization to occur, or fertilization can occur, but they come here, they cannot implant here because there is an anatomical problem, then you have infertility. Or even this egg is not coming out, that means there is a problem with ovulation. So all these things interwork together to make sure that pregnancy is achieved. Okay, why is women stigmatized? Usually, especially in the Gambia, I will take Gambia as a context, we have a lot of stigmatization towards women who are infertile. Now, you'll hear some people use the word, you will be in pain, they are sterile, you are barren, all these things they use. Sometimes you'll hear in-laws say, we cannot keep a woman who cannot produce children. A lot of things can be said about a woman who is infertile in the community. And unfortunately, what people fail to understand is sometimes the woman you are stigmatizing might not even be the problem. Because I had about 2 cases of such. When we did sperm analysis, semen analysis, we realized that the man has azoospermia. Eventually, the marriage could not go. The woman went and married somewhere, and now she's having the 2nd child in that marriage. The man still cannot have. So you do see that the people in the family who are stigmatizing the woman, later we realize that actually not the woman that is the problem. And most of the time, the stigmatization in our community is more placed on women than men. Of course, men have their part of the problem where your colleagues will say, you, when are you going to have your child and all those things? But it's more on the woman, which really is traumatizing. And unfortunately, it is not helping. Can I move to the next slide now? Now, the reason why women are stigmatized is poor knowledge of fertility and infertility issues plus financial problems. Now, you go to your husband and say, I need to go to the hospital today to do certain things. The husband will tell you, I don't have money. I want you to go with me. He will say, I cannot go. And all those things are issues of women because they cannot solve most of their problems on their own, especially in our setting here. They have to depend on their husband for financial needs. Now, the perfect equality between men and women is a factor, big difficulties for men to consult, poor management of infertility problems, low purchasing power of women who consult, and unfavorable health pyramids. So you can see that even though a woman wants to go to the hospital, but they do not have the ability. They could not have the financial ability. Men are a problem when they tell men to come for consultation, they will refuse. All these things are factors that affect infertility. Now, how to fight against the stigma of women? First of all, we have to educate all women at levels. Now, education is power. When women are educated, they understand. And we have realized that this stigma of infertility is more into the uneducated level than the educated women at some level. Of course, they are also worried, but the stigmatization is more on the illiterates more. Now, the training for adults and young people, we need to train people to understand, in fact, first of all, what is infertility? How do you prevent infertility? Like I said earlier, people will just go to say, I'm infertile, when actually their husbands are not even here. When they have about 4, a husband in a polygamy marriage, your husband is away for some time, 3, 4 wives is rotating. So you don't have even an adequate sexual intercourse, and yet still you'll be complaining that you are infertile. So people need to be educated to understand. Integration of women and girls, they need to be integrated into community to understand what their role is. They need to know that women's role is not only to bear children. Like you said, they are just more than a mother. They can do other things in the community that can help. The major role of the media is very, very important. I think this is the message that we're talking about here, that the media needs to send to the people. That having a marriage for 2 months and you are not pregnant is not considered infertility. They need to also send that message to the people that we have availability of some of the basic care things that you can have. Now, you don't need to go to traditional healers. You don't need to go to certain areas that they cannot do professional care for you. The media needs to send those things that are available in the country so that people understand. And they need to send the awareness message to people also to improve their awareness of infertility. The involvement of civil society groups, they need to come up, sensitize people, talk to the people. Why do people have to stigmatize people who do not have children? And there are people in the world who have children who have no benefit from their children. So these are things that the society needs to understand. The detrimental role of the public authorities. So the public authorities also needs to help us. What kind of care can we give to these people? I remember there is nothing in our health policy in terms of infertility. Just recently, this year, we have started incorporating something about infertility in our health policy. But before there was none. So these are things that are also affecting anything that you see somebody do infertility is on private own, which is very, very expensive. But thank God the Ministry of Health this year have tried to incorporate infertility care as part of our health policies. On that note, I thank you very much. In terms of the context, it is divided into 2. We will first look at the media context, and the media context is that the media actually is doing quite well right now because we have emerged from a very difficult period. For 22 years, the environment has been very much restricted, and but now we are having a lot of proliferation of media houses. The last time I checked, I think the database shows that we have more than 65 media houses, radio, TV, newspapers, and and online platforms included. And this is a significant jump. This is more than double the number that was there prior to the change of government in 2017. The most beautiful thing about what is happening in the country right now, and all of you, the attendees know, is that you can now report without any fear of repercussions. For some of you that are quite new in the field, you may not recall this, but there were times before that when you write a story, you're going home, you don't go home straight, you go somewhere else and sleep there, so that if someone comes looking for you, they may not find you there. We cannot have a media, or we cannot have press, or even journalists in the Gambia when we are having women suffering the way they are as portrayed in the video, and these things don't feature in the press. Because we have a role. Our role is to make sure that there is provision of adequate laws and policies to protect women. If those laws do not exist, it is our job to highlight them, to make sure that they exist, so that people are protected. The issue of reporting would be quite important. We can report on caregiving, reporting on local justice administration in the country. I've never actually seen any case anywhere in the Gambia about how a woman was affected or was discriminated or was even abused or violated, and the matter was reported either from the police or from local justice or the chiefs, or those kind of structures there, or even at national level. I've never seen it.
The radio, like any other media, has three cardinal rules. And these cardinal rules are actually to inform, to educate, and most especially to entertain. But now, the role of the media, especially radio, have gone beyond just entertaining, educating, or actually to entertain, but actually to help people to make informed choices. Because when people listen to programs, when people watch news, when they are informed, they can actually make informed choices and informed decisions. So the benefits of radio. Radio is immediate. When something is happening, once a journalist is there, he or she can file a report live, and people will get to know what is actually happening. So you don't have to go back to the studio and work on the story. You can just do a live report and people will hear. And this is just because this technology is simpler than that of the newspaper, and also simpler than television. It is also accessible. You can tune into radio wherever you are, whether you are going jogging, whether you are cooking in the house, whether you are at the farm, you can actually access radio. We all know that now mobile phones, almost all mobile phones have radio, and because they all have radio, it makes radio accessible to the public. So the role of radio in raising health awareness, actually, in health crisis, or in a health situation, in a crisis situation relating to health, the media, especially radio, has the power to save lives by actually providing factual reports, dispelling rumors and fake news, getting the message out at the right time, from the right sources. Because if we get the right sources to our platforms to talk about issues that are affecting the people will listen, and they would get to know what they were missing actually. Providing timely and relevant information is also a critical role that radio can do in raising public health awareness. It is important to note that effective communication can help prevent or reduce the spread of disease, or this infertility we are talking about, once we effectively communicate to the masses through the use of radio, we can actually reduce the the stigma around it, and we can also guide people that are affected to actually seek health services and also treatment. So the following tips must be observed when dealing with vulnerable groups. First of all, you need to find a safe place and a quiet spot for interviews. Take extra care. And the third one actually is, when you get information, you need to corroborate the details. Corroborating details are very important. And in case of the infertility, use your media very carefully. And the fifth one is actually get experts in the studio to talk about the causes of infertility and how they could be treated. Do not let in-laws use your platform to malign women going through infertility, because some of these people, like we know in our cultures, they call them names, they ostracize them, they say all kind of things. So do not interview this kind of in-laws, because they're only going to add more pain to the woman that is going through this thing. The problem might not be solely on the women, but the problem might be on both the men and the women, like Dr. Masirending said. And the golden rule is to be responsible, to be accurate, to be accountable, try to be as balanced as you can, be independent in your work, and if in doubt, consult the GPU Code of Conduct. So this is the end of my presentation, and thank you very much for your kind attention.
Now, the same thing that we reflect on COVID-19 could now be reflected on the infertility. Like, we listen to the two veteran doctors who have broken the topic very carefully. And, now it is the turn of the journalists now to ask questions. When you are ready to talk on infertility, you really need to map the mind. Your mind needs to work on certain basic information, such as, how much infertility, how much the different history in where it is, or in country, let's say Gambia, how much it is an issue, where is it happening? Is it based on the geographical situation, or just certain parts of the country? Who is affected? Is it based on the age group and then the gender of the people, male, female? So good that we got information that in the presentation of Dr. Jai, you can see 30% contribution from the women, 30% and both of them 30, so 10% on for so far. So it would be very good to work with doctors and get this information. If you look at the sources, journalists, we don't manufacture information. We rely on the sources, because we know the right source actually gives the right information. So if you can look at the flow here of information. So in the medical context, we need people like doctors, specialists who really know about infertility, which we have got today. The presentations are insightful and informative enough to inform journalists what to know about infertility, because you must be informed first before you can inform anyone else. This is very important. So the case experience, who is experiencing this, those are the cases. Are they the women folk or the male folk, who, or both of them? So in terms of number, you have established the number of people affected, or likely to be affected, because the culture of violence is very prominent and an issue in Gambia. So from there, then you can figure out stakeholders. So I think they could touch on this very well. The stakeholders, let's say in the case of government, when it comes to treatment, how accessible or how effective or efficient is the situation in the Gambia. So the role of government as a stakeholder in the treatment or getting the issue of treatment for people affected? Is it accessible, or is it just something that is very cheap or very costly? So the activists they have role here. You know, activists can feel very free. They don't, waste time in telling you, how to break down the context that you can get from the medical side. They can easily blame whoever deserves the blame or, recommend a practice. So we as journalists cannot be activists anywhere there. Yeah, so that was it. I hope you have one or two questions, and then.
Thank you. Hello? Can you hear me?
Yes, I can hear. Yes, Brian, I can hear you.
All right. If there's any, do we have any questions and questions that need answers? Please submit your questions so our experts can answer them. You can type in the chat, or if you want to ask a question, just raise your hand and we'll be able to see you so you can ask live. Also, these presentations will be shared. We encourage you to continue the conversation in the WhatsApp group so you can benefit from some of these resources. And as the questions come in, I want to welcome the CEO of Merck Foundation, Senator Dr.Rasha Kelej, for her closing remarks.
Thank you. Thank you very much, Brian. Thank you, all our media partners, our esteemed speaker, for the beneficial and amazing training, first health media training for the Gambia media to emphasize on how to sensitize the communities and break the silence about infertility stigma, critical issues like infertility stigma and girls' education. I am looking forward to receive your amazing work after this training. And I'd like to especially thank Her Excellency, the First Lady of the Gambia, Her Excellency Mrs. Fatoumata Bahbaru, and congratulate her for winning the second term. And I wish that everything will be okay after that, and we are going to receive your work, media coverage about these topics, so we can keep the momentum and also apply for the next year award. We are still revising your application. If you send us application for the previous year award, and we are going to announce it in January. But I'm looking forward to receive your application at submit at merck-foundation.com for your media coverage of this year award, next year award 2022. And Happy New Year. See you next year. And I wish you good luck, and great to have you. Thank you.